Imagine waking up unable to move one side of your body, no chest pain, no warning, just paralysis. What if I told you that the way you positioned yourself last night could determine whether this happens to you? Recent medical data reveals something terrifying. Your sleeping habits might be slowly damaging your brain right now. Welcome to my YouTube channel. I'm Dr. Robert. What I'm about to share might change how you think about bedtime forever. Medical researchers have discovered that roughly 1/3 of all stroke events happen during nighttime hours or immediately upon waking. But here is what shocked me most as a physician. These aren't triggered by what you ate, your stress levels, or forgotten pills. Often, they're connected to something hiding in plain sight: your sleeping patterns and bedroom habits. Today, we're going to explore the hidden dangers lurking in how you rest, and I'll show you simple adjustments that could literally save your life. Let me share something that changed my entire perspective. A few weeks ago, a patient walked into my office describing a frightening experience. She was 64, physically active, ate balanced meals, and her blood work looked decent. Yet one morning, she woke up with severe disorientation and weakness on her left side. After thorough examination, we discovered she'd experienced a minor cerebrovascular event during sleep. What caused it? Not genetics, not diet, her sleeping arrangement. Here's what most people don't realize. After age 50, your circulatory system becomes increasingly vulnerable during rest. Blood naturally thickens overnight. Blood pressure fluctuates with body position changes, and seemingly innocent habits like how you angle your neck or where you place your pillow can create dangerous pressure on delicate blood vessels feeding your brain. The encouraging news? Unlike genetics or age, your sleep environment is completely within your control. The zero pillow danger: many people believe sleeping completely flat strengthens the spine. While this might seem logical for anyone over 55, especially those managing blood pressure issues, this creates a serious problem. When your head rests at the same level as your heart, gravity pulls blood toward your upper body and brain. In younger people, this isn't concerning, but aging blood vessels are fragile. This position elevates pressure inside your skull, potentially straining the tiny vessels in your eyes and brain. I've treated patients who regularly wake with throbbing headaches, dizziness, or vision changes, all early warning signs of circulation problems they never connected to their pillow choice. The fix is straightforward. Elevate your head approximately 15 to 30 degrees above heart level using a quality supportive pillow. This gentle angle promotes healthy blood return without straining your neck. The right side sleeping risk: most people never consider that which side they choose matters medically. But your heart's position inside your chest makes this surprisingly important. Your heart naturally tilts leftward. When you sleep on your right side, your body weight shifts, potentially compressing a major vein called the inferior vena cava that returns blood to your heart. This forces your heart to work harder, pulling blood upward. Additionally, right side sleeping can press your heart against your chest wall, slightly restricting its pumping motion. For healthy individuals, this usually isn't problematic. But for someone with existing heart concerns, high blood pressure, or irregular heartbeat, this position can worsen symptoms and reduce oxygen delivery overnight. The better alternative? Try left side sleeping. This position relieves pressure on that major vein and gives your heart freedom to pump efficiently. If you tend to roll over unconsciously, try hugging a body pillow. It helps maintain position throughout the night. The pillow tower problem. I frequently see patients who stack multiple pillows, thinking it helps breathing or prevents acid reflux. While the intention is good, execution often backfires. Excessive head elevation forces your neck into an unnatural forward bend, compressing the vertebral arteries running along your spine into your brain. These arteries are critical for supplying your brain stem and inner ear. Even partial restriction during 8 hours of sleep can lead to poor brain circulation, morning headaches, neck stiffness, and dizziness. Use one medium-height memory foam pillow that supports your neck's natural curve without pushing your chin toward your chest. If you genuinely need inclined sleeping for reflux, use a wedge that elevates your entire upper body evenly, not just your head. The fetal position trap. The fetal position feels instinctively comforting, especially during stress. But when done tightly, knees pulled up, chin tucked, spine curved, it creates multiple problems. This compressed position restricts your chest expansion, limiting how deeply your lungs can fill with air. Reduced oxygen intake means reduced oxygen in your bloodstream, which becomes increasingly risky with age. The modification is gentle: simply relax the curl. Straighten your legs slightly, avoid excessive upper body curling, and place a full-length body pillow between your knees and arms. This maintains comfort while keeping your spine more neutral and your breathing unrestricted. The late eating danger. This habit seems harmless but carries serious consequences for older adults. When you eat a large evening meal, blood redirects toward your digestive system. That means temporarily less blood available for your brain, and particularly dangerous for those with narrowed arteries. Add alcohol to this equation and risk multiplies. Alcohol expands blood vessels suddenly, potentially dropping blood pressure. For seniors, these sudden fluctuations stress vascular walls, potentially causing ruptures in weakened vessels or triggering clot formation. My recommendation: finish dinner at least 3 hours before bed. If you drink alcohol, stop at least 5 hours before sleep. After dinner, take a gentle 15-minute walk to promote circulation and stabilize digestion. The 2 best sleep positions. Now let's discuss the 2 scientifically supported sleeping positions that actively protect your brain and heart. Left side sleeping offers multiple benefits. Anatomically, since your heart sits slightly left of center, left side sleeping reduces the pressure your heart works against, promoting better blood flow to your entire body, including your brain. There's also a fascinating waste removal benefit. Your brain has a cleaning system called the glymphatic system that clears toxins and harmful proteins during sleep, including compounds linked to Alzheimer's disease. Research shows this cleaning process works most efficiently when sleeping on your left side. Bonus: left side sleeping also helps prevent acid reflux. If left side sleeping isn't comfortable, back sleeping with gentle elevation works excellently. Elevate your upper body about 15 to 30 degrees using a wedge pillow or adjustable bed. This position reduces intracranial pressure, lowering the risk of small vessel problems in people with fragile blood vessels or high blood pressure. It also improves breathing, ensuring better oxygen delivery to your brain overnight. Creating your stroke-proof bedroom. Your sleeping position matters tremendously, but your environment plays an equally critical role. Keep your bedroom between 18–20 degrees Celsius. A cooler environment helps your core temperature drop, essential for deep restorative sleep and naturally lower nighttime blood pressure. Eliminate blue light after PM. Phone screens, tablets, and televisions suppress melatonin and delay the deep sleep stages when your brain clears harmful plaque. Invest in a quality cervical pillow that supports your neck's natural curve. Use earplugs or white noise machines to prevent sudden sounds that spike heart rate and stress hormones. Consider using an overnight pulse oximeter to monitor oxygen levels. Repeated drops may signal sleep apnea or poor circulation, both significant stroke risk factors. Here is what I want you to remember. Most people only think about sleep position regarding back pain or comfort. But as we've uncovered today, sleeping incorrectly can silently elevate your stroke risk, especially after 60. By affecting blood flow, oxygen delivery, vascular pressure, and even toxin clearance in your brain. The beautiful part? You don't need expensive treatments or prescriptions. You simply need awareness and willingness to adjust one habit. Change just one thing tonight. Pick the easiest adjustment. Maybe it's switching to left side sleeping, maybe it's replacing your pillow, maybe it's finishing dinner earlier. That single change could dramatically reduce your stroke risk and protect your brain for decades to come. Now I want to hear from you. Which sleeping position do you normally use? Have you been experiencing morning headaches or brain fog? Share your experience in the comments below. If you found this information valuable, I've created another essential video about warning signs your body gives you weeks before a stroke happens. Watch it next. It could save your life. Subscribe and turn on notifications so you never miss life-saving health information.